Dear friends and colleagues, I'm greatly proud to be present at this wonderful meeting, unfortunately this year only in online mode. And let us introduce the results of our study. The first report is type and severity of traumatic subaxial cervical spine injury as predictors of neurological dysfunction. Cervical spine trauma combined with spinal cord injury is one of the most severe outcomes of traumatic influence on human organism. High mortality and disability, the significant cost of treatment and rehabilitation, as well as often lifelong need for outside care, determine not only medical but also the social significance of the problem. The orthopedic component of cervical spine injury determines the initial significant economic cost of therapy due to the need of reconstructive surgery, which is often requires expensive stabilization systems. However, it is the neurological component of injury, namely spinal cord dysfunction, that either directly or indirectly causes high mortality and determines the further costs of long-term rehabilitation and social adaptation of the victims. High levels of disability are not directly related to damage of the supporting structures of the spine and the development of instability, but to the development of persistent neurological deficit. The aim of our work is yeah, to identify the possible influence of type and severity of traumatic changes of subaxial cervical spine on the value of neurological disorders. We performed a retrospective analysis of X-ray film data, CT, and MRI scans of 168 patients with traumatic spine and spinal cord injury at subaxial level hospitalized to Department of Spinal Cord Pathology of Ramadan Neurosurgery Institute in the period from 2008 to 2018. The criteria for inclusion and exclusion in the study are presented on the slide. In order to obtain more adequate results, we excluded from the study patients with multi-level cervical spine injuries, since the interpretation and comparison of the analyzed parameters has certain difficulties. All patients were assessed for the type of damage using a subaxial cervical spine classification standard algorithm. We define standard types and subtypes. Any displacement gives class C. Tension band injury gives class B. Flexion is subtype B1 or B2, and extension B3. Vertebral body fracture with different value of severity was determined as class A. A quantitative assessment of the instability degree was performed using cervical spine injury severity score. Neurological disorders were assessed using international standards for neurological classification of spinal cord injury. Here's a case example. 28-year-old man got his cervical spine trauma in road accident. When assessing the data, we have type A3 fracture. Cervical spine injury severity score gives 9 points, and neurostatus 148 points. When assessing the dependence of the severity of neurological dysfunction on type of injury, the following picture is determined. The most severe neurological symptoms are determined in groups A4 and C. The values of spinal cord injury scales are 80. 97 points and 83 points respectively. Slightly higher rates are registered for A3 type of injury. 196 points. Within other groups, the median values are in range from 251 to 289 points, with a fairly wide interquartile range. We used Kruskal-Wallis test to assess the difference. Statistically significant difference were revealed. The obtained data show that ondulation of type A4 and C are statistically significantly different from other groups. Such results are to some extent consistent with modern ideas about biomechanics spine injury and have a certain basis. It is known that in type A damage suffers mainly anterior support complex. The degree of damage progressively increasing in fact determines the subclasses from type A1 to A4. In this case, the arches of vertebrae, which together with the ligamentous apparatus form the posterior wall of spinal canal, often remain intact. Accordingly, spontaneous decompression, which may be due to the damage of posterior support complex, does not occur, unlike type B. Therefore, the value of neurological disorders in type A is directly related to the degree of destruction of the vertebral body. As mentioned above, one of the key criteria that characterizes cervical spine injury is the degree of instability that is assessed using cervical spine injury severity scale. Accordingly, it is natural to assume that the degree of spinal cord damage may have some relationship with the cervical spine injury severity score scale. Analysis of our data shows the following results. The linear regression model is characterized by a high level of reliability, but also a fairly low coefficient of determination, only 0.215. The probable explanation is that within various types of damage, the degree of instability has different influence on the formation of neurological disorders. So we made regression analysis for each type of lesion. Here are the results. It is noted that the value of the coefficient of cervical spine injury severity score points is always negative. So there is an inverse relationship. With the increasing degree of instability, the number of points of spinal cord injury scale decreases. The calculated coefficients are statistically significant for A3, A4, B2, and C types of damage, and do not greatly differ. On average, the increase in cervical spine injury severity score by 1 point leads to decrease in spinal cord injury severity scale by 30 points with the analyzed range of values. When analyzing the linear multifactor dependence of the type, it is determined that the adjusted coefficient of determination of the model is equal to 0.382. And when analyzing the model, taking into account the interaction of factors, the prognostic efficiency of the model is increasing to 42.5%. Analysis of variance reveals a statistically significant difference within uh, coefficients of determination. So we made a conclusion that both type of lesion and values of instability play a significant role in determining the degree of neurological disorders in patients. The most effective predictive model is built with the interaction of above-mentioned factors. The level of instability and the nature of damage determine slightly less than a half of overall picture of neurological disorders. The degree of compression of spinal canal, impaired cerebrospinal fluid dynamics, traumatic changes in spinal cord also play a certain role in the formation of neurological deficit of the victims. Further research is needed to determine the most informative predictive criteria and tactical approaches. We have no conflict of interest. Thanks for your attention.